So my name is Consuela Lopez. My pronouns are she, hers, and hers. And my position here is Director of Operations at Casa Ruby.
My name is Aiden McDaniel. My pronouns are him, he, his. I am transgender.
Bishop Allison Abrams, and pronoun is she, her, hers. I'm the CEO and founder of Empowerment Justice Center, and out of Empowerment Justice Center, we started the EJC Wellness Center.
I'm an adult therapist.
Obviously, when I was a teenager, I wish things had been different in my life where I could have understood myself a little bit better, and where I understood that there were outlets for me. I mean, back when I was a teenager, there was no such thing. Not that transgender individuals didn't exist, or that terminology wasn't around or anything like that. It's just that it wasn't very open, and I think we're now kind of in an era where transgender and gender identity is more at the forefront, and people are paying attention to it more. People are being more socially aware of it and positive with it, and there's just so much out there in the media, and so I thought, hey, great time to really take this step.
My first experience was taking hormones at the age of 18 and realizing that it wasn't covered under health insurance, under any kind of health insurance. And I started hormone replacement therapy in 1992 in Washington, D.C. Before it was actually legal to, before the doctors actually started taking on and taking on more trans patients and knew how to give hormones, we would buy them from our friends, or we would buy them from like back alley places. It really was because we needed to take the hormones because we realized that hormone was a gateway to transitioning. And I don't know, it was just difficult. It was difficult not realizing that you were doing something as far as taking hormones and realizing that you were doing something good for yourself. We just did it because we were, at least I can speak for myself, because I saw my friends do it and I saw the difference in them and I was like, ooh, I want what I can see what they're doing, so I gotta do it. But the doctor that I went to, luckily, was a medical doctor, but I don't think all he did was really prescribe hormones. So he wasn't an endocrinologist. He was a regular internal medicine practitioner. So it was just like, it was a loop that our friends were like, go to this doctor, he'll give you some hormones. So that was a benefit, that we did go to a doctor. But for many years, I would buy them from friends. And, and then it came to a point where we didn't know what we were getting sometimes, because everybody didn't have the luxury of going to a doctor, and everybody didn't really have the luxury of like buying hormones to continue them throughout. So you would take them for like 30 days and then you'd be off for 3 months, and you would take them for another 30 days, or depending on the supply amount that you had. So that was kind of, it's not consistent, and it would I'm sure make your blood levels like go up and down. I'm not a doctor, but yeah. In places like this, Casa Ruby, where you come to meet people that are like yourself, and you mentor people, because I was unfortunate, and I had some botched surgeries that I wouldn't want my other community, not my other community. I had some botched surgeries where I wouldn't want my future community of trans women of color, or trans women in general, sorry, not just of color, but trans women in general, to go through the same thing that I had to go through, because those things weren't accessible. And for some, they weren't affordable, right? Because transitional surgeries are very expensive. And if you don't have a lot of money, and you don't work a lot, you don't have a lot of money to pay for that. So that goes back to remember the hormones, where you would have it for a month and then maybe off for 3 months. So it's not consistent, and it wasn't able to help you.
We had a few transgender persons coming to the church, and we assisted them with their transition process in praying for them, also celebrating the milestones they made. We did actually have a woman who transitioned to a male, and they wanted to be rebaptized as the male because they had not been baptized as the new name in which they received from the state. I do understand that churches have hurt people, ministers have hurt people, family members who are religious have hurt people. However, there are some churches who are affirming, and there are some churches who are loving, and there are some ministers and pastors who are caring and do want to see people at their best and whole and healed. And so I just believe that as people begin to approach dealing with the mental health piece, they also need to include the spiritual piece. Because, while yes, you may be able to transition your physical body, where's your mind? And then after you deal with all the things that have happened to you mentally, then where's the spiritual piece? You've got to address that as well. So once you can get all three of those, I think that person will be whole or working and moving towards wholeness and healing. I think it's important to acknowledge the historic trauma piece at Empowerment Justice Center, Wellness Center. We really do deal with that because you have to go back and deal with all the hurt and pain that people have had over the years. And so that started way before they even started making the transition. It started with who they believed that they were, and then when they expressed that, what happened to them. And so we do have to, I believe, go back and deal with some of that. And even in Black and brown communities, there's, I believe, an added level of trauma because of this country and how they treat people who are of Black and brown skin. And so you have that to deal with, and then you have the violence piece to deal with. So many people in the transgender community who are Black and brown and are trans female have to deal with violence. And so we have to address those issues as well at the EJC Wellness Center. And so I just believe that there are a lot of things to address in order to bring healing and wholeness, but we are working here at EJC Wellness Center with our partners to help bring healing to those who are open to receive the services that we're offering. Because first you got to be open to it. You can't force people to come in, but if they will come in, we will work to bring healing and wholeness and wellness to them. So we do have clients that we refer to psychiatrists that come here that do express that that is what they would like. And so we do the referrals to psychiatrists. And then from that, then they work with an agency that would help them to be able to get those hormones.
I think they require you to have a mental health evaluation just to be prescribed hormones, and I think you have to be transitioned for 2 years in order to receive any kind of transitional surgery. Don't quote me on 100% because I'm not a healthcare specialist, but I do know a little bit about my own healthcare.
Mm-hmm. I mean, for example, like a client who just wants, like hormones will have to, in the gatekeeper model, they have to come see me, even if they have no mental health issues at all. And they didn't want to see a therapist. It wasn't their choice, but they're required to. And it's often framed as I have to clear them, for care that they need. So the providers that are not as comfortable with it will sometimes, they'll be asking a lot of questions about, do I think the patient is ready, or do I think that, you're right, like, I don't think that it's my job to decide if the person's ready. I think it's my job to clear the barriers so that they can get care that they need.
Luckily, One Medical is informed consent. I couldn't imagine going the other way. My partner is a transgender therapist, and so she works for an organization that does gatekeeping. She tells me about stuff all the time, and I couldn't imagine with the kind of psychological um, uh, experience that you kind of have to go through to even make that leap to a physical transformation. I can't imagine, going into an organization and sitting down with a complete stranger. And even if you're someone who has been who has had hormone replacement therapy for years, having to go in and sit in front of somebody and justify why you want to continue with hormone replacement therapy, and it's almost like I don't know. The process is that gatekeeping model is it just feels insane. It takes so much to come to a conclusion anyway that you're going to do a physical transformation. If it were as easy as snapping your fingers, then awesome, we could all do that. But and I certainly would. But there's so much more involved in it. There's pain. There's medication. There's lots of doctors that you have to see. You get really up close and personal with yourself. I can't imagine having to go through an additional layer of trying to justify who you are. I think that would be infuriating to me. So I'm glad that I'm with an organization, medical organization that I don't have to do that.
Oftentimes a person will come in and tell us, what they are trying to do and where they would like to go and what they hope to see as a result of their transition. And so basically, I think it's the therapist's job to just help them to work through that, not suggest anything, but allow whatever that person is looking to accomplish to just kind of work with them through that and make sure that, it's not something that they're not going to appreciate in the next couple of months. Just make sure that what they're doing is the best for them at this current time. Because I have seen people who have said that they're ready to transition, and then a week later they were saying no, they don't want to transition. And so you have to have somebody to help you to work through those types of things because people do experience emotional ups and downs. They do experience different fluctuations in different things in their bodies and in their minds. So therapists are here to help them work through that and to make sure that this is actually what they want and this is actually the best for them and this is actually the best time for them and to make sure that they are actually on the path that they desire to be on.
I'd like to see informed consent. That would be ideal across the board. I think that there's medical providers are often concerned about things like liability, and they're concerned about things when they're doing a gatekeeper model that it looks like it's patient care. And I think a lot of times, the providers have good intentions when they're doing it, but cis patients aren't treated the same way. So, it's I think sometimes it's just looked at very differently, but it's, it's really transphobia that's like underlying it. They wouldn't, agree with that, I'm sure, but